I'm Shrey Shah. I'm a graduate student at the University of Maryland College Park, and I received the 2024 Pharma Foundation Predoctoral Fellowship in Drug Delivery. I grew up in a scientific background. I would say like my both my parents are doctors, so like I was inclined to do that. But I also liked building things, so I did not want to go directly into like just biology. So I took up like chemical engineering first, which was closer to like biology. Plus, I could do some engineering. I had my maternal grandfather who had like cancer, who died of cancer while I was in undergrad. So like it was not like because of that I chose to be in science, but that is the reason I'll still stay in research for sure. My Pharma Foundation research is based on treating autoimmune diseases. So currently autoimmune diseases, which are diseases in which our own tissues attack our own cells to lead to like various symptoms including vision impairment, loss of motor control, and sometimes even paralysis. So these diseases actually lack cures. So my research focuses on understanding how we can utilize the skin, which is like one of the barrier tissues. And if you think about it, we are constantly exposed to thousands of germs, pathogens, but we do not always fall ill, right? So we can use that specific property of the skin and target materials to that or drugs to that to drive a response which helps treat us autoimmune diseases. So my research specifically focuses on developing materials called microneedles, which we can deliver immune cues to the skin and utilize that property to treat autoimmune diseases. I like to work with materials a lot. So I like to make new materials, novel material technologies that can be applied to biological systems. For example, the microneedles that we are making are made from gelatin, which is like in all our foods. These microneedles are tiny micron-sized needles that can be applied just like a normal band-aid. So it's also like increasing accessibility of the treatment as well. Plus, the materials that we use to make these microneedles also protect the cargo from harsh environmental conditions, which could enable sustainable distribution of the treatment. So overall, what we're trying to do is like trying to make a treatment which is more accessible, more sustainable, and also helps treat a disease which does not have a cure yet. The Pharma Foundation Fellowship will first help me complete my thesis defense. So it will be like a good step for me to like have the funding to complete my project, to get a thesis done, get my PhD. Secondly, I'm also exploring career options right now, so it will help me grow and expand my network. One advice I have for specifically applying to the Pharma Foundation Fellowship is to first start early. Second, I would say that think about your science in terms of like the lay audience and how you can explain it in like really brief language. That yes, you need some technical stuff that are technical jargon, but not too deep, because you want to try and explain it in a way that is very understandable and it gets to the fundamentals that why you are doing what you are doing. Keep on learning. Like I feel that I learned a lot of things that I'm not using now, but I feel that maybe someday in my career I might get to use them. For example, like during my masters, I learned like a technique of nanofabrication, which was not exactly like bioengineering, but I'm using that to actually make microneedles now. One thing I'm sure about is I want to stick in research and development. So short term, I'm not sure. I'm exploring career options. Currently, I'm inclined towards academia, but I'm also exploring like industry. But long term, I definitely want to have a high impact immunoengineering lab, which is like more materials focused. So like because I'm a chemical engineer, I love working with materials, so developing new materials or understanding the interaction between materials and biological systems